Welcome to Healthy Lifestyle Tips, the go-to place for practical and beneficial health advice. We're here to demystify the world of health, breaking down complex topics into easily digestible bits of information. Our aim is to empower you with knowledge, helping you make informed decisions about your well-being. We believe that understanding our bodies is the first step towards leading a healthier, more fulfilling life. So let's get started on this journey together. Today, we delve into a common health issue. Many of us may have heard about appendicitis, a term we often hear. But what exactly is it? Well, let's break it down. The root word here is appendix, a small pouch-like organ that hangs from the large intestine, specifically the colon. The added itis at the end is a medical term used to signify inflammation. So appendicitis, in essence, is the inflammation of the appendix. But why does the appendix get inflamed? The most common cause is a blockage, which can occur due to a variety of reasons. At times it could be a result of an infection where the lymphoid tissues within the appendix multiply and lead to swelling. This swelling can then block the appendix. In other instances, it might be a hard piece of stool that gets trapped in the appendix. Yes, as unpleasant as it sounds, it happens and can cause a blockage. When the appendix gets blocked, it can lead to an increase in pressure, disrupting blood flow and leading to inflammation. This inflammation can cause the appendix to fill with pus, and if not treated promptly, it can burst or rupture, leading to a serious, life-threatening condition called peritonitis. So while the appendix might be small and seemingly insignificant, it can cause quite a stir when it gets inflamed. But it's important to note that appendicitis isn't a condition that develops over time, like arthritis or heart disease. It's an acute condition, meaning it comes on suddenly and requires immediate attention. It's also worth mentioning that anyone can get appendicitis, regardless of age or gender. However, it's most commonly seen in people between the ages of 10 and 30. In summary, appendicitis is an inflammation of the appendix, primarily caused by a blockage due to infection or a hard piece of stool. It's an acute condition that requires immediate medical attention. But don't worry, recognizing the symptoms early can lead to effective treatment. Now that we know what appendicitis is, let's explore its symptoms. Appendicitis is not a silent ailment. It announces its presence with certain symptoms. One of the most common and clear signs is a sudden pain that begins on the right side of the lower abdomen. It might start as a mild pain near the belly button that gradually becomes severe and shifts to the right lower abdomen. Then there's the nausea that sometimes accompanies vomiting, another red flag. You might also experience a loss of appetite, which is unusual for your regular eating patterns. Other symptoms might include swelling in the abdomen, a fever, and the inability to pass gas. These signs might not always point to appendicitis. They could be indicative of other health conditions too. However, if you experience a combination of these symptoms, particularly the severe abdominal pain, don't dismiss it. Seek immediate medical attention. Why? Because appendicitis is a medical emergency that typically requires prompt surgery to remove the appendix. Left untreated, an inflamed appendix will eventually burst or perforate, spilling infectious materials into the abdominal cavity. This can lead to serious complications. Remember, early detection is key in managing appendicitis. So you suspect you have appendicitis. What's next? The most common treatment for appendicitis is a surgical procedure known as an appendectomy. This operation involves removing the inflamed appendix to prevent it from bursting, which could lead to a serious, even life-threatening infection known as peritonitis. Appendectomies can be performed as open surgery, where a single large incision is made, or as a laparoscopic surgery, which involves several small incisions and the use of a camera to guide the surgeon. In some instances, especially when appendicitis is caught early, antibiotics may be used to treat the inflammation. However, this is less common and is usually followed by surgery at a later date to avoid recurrence. It's important to remember that while this information can be helpful, it's not a substitute for professional medical advice. Always remember to consult with your healthcare provider for any health concerns. We've learned a lot today about appendicitis, haven't we? We've dissected this often misunderstood condition, shining light on what it truly is, an inflammation of the appendix. We've navigated the signs and symptoms, providing the knowledge to recognize them. We've also delved into the treatment options, equipping you with the understanding to make informed decisions. Knowledge is power, especially when it comes to health. Don't forget to subscribe to Healthy Lifestyle Tips for more informative videos like this one. Stay healthy.